This is an analysis of Spring Hill, Florida, presented by Kelly Weckbacher and Lauren Brennan. In this video, we will begin with a historical overview, followed by an analysis of the community's structure, population, health-related resources and availability, environment, and government and public policy. We will also discuss a number of the community's needs and compare one of them on a global perspective. While Spring Hill is fairly young in age, it now houses a community that holds quite a bit of history, known as Bayport. Bayport community sits just along the water of Florida's Nature Coast and was once a small but bustling port town used as a key Confederate supply depot during the Civil War. Between 1863 and 1865, the U.S. Navy raided the Confederate-held port a total of 5 times, one famously known as the Battle of Bayport. Cotton, produce, and timber were major exports after the war, and during the Prohibition, the small community was also popular for bootlegging operations. Bayport's end as a supply line came when the Brooksville train depot was established in 1885, but by this time, the town was already a popular haven for fishermen and sportsmen, as it was featured in a nationally circulated travel guide. The city of Brooksville was founded in the 1940s and held a military fort, Fort DeSoto, that was established to give settlers protection from Native Americans. It was also once a popular trading post. Brooksville sits about 15 miles east of Bayport, and there were many routes established between the two communities for trade. Eventually, these routes became dirt roads, then paved roads, then two brothers had a vision of the area. Having already founded a few successful communities, the Mackle brothers advertised model homes that were to be located in Spring Hill in Grand Central Station, and sales quickly soared. While only having been founded in 1967, today Spring Hill has the highest population in the county with roughly 93,000 residents. More residents leads to more businesses, more roads, and more houses. In the last 10 years alone, Spring Hill has seen a tremendous change in once isolated areas, now with shopping centers, apartment buildings, and restaurants. Spring Hill is comprised of houses and apartments, along with 9 apartment complexes suited for low-income families. There are no homeless shelters, however, the nearby towns of Brooksville and Hudson have 5 or more. There are 5 elementary schools, 3 K-8 schools, 3 middle schools, and 4 high schools, with a 3-school complex having been recently built in 2010 to support the ever-growing population. Residents have many outdoor and recreational activities to choose from at any of the 10 parks throughout Spring Hill. With access to the water, a few of these parks make Spring Hill unique, giving residents the option to enjoy water sports or a relaxing day on the river. 2 public libraries are located on both ends of the community, with public computer access, meeting rooms, and book clubs. There's a bus system that runs Monday through Friday from 6 a.m. to 7 p.m. that has a $1.25 fare for one way, with reduced price passes available. The community accommodates its residents well, with plenty of housing, schools, parks, etc., and although there doesn't seem to be any major issues, many residents complain that the community lacks leisure indoor activities when compared to Tampa or the surrounding bigger cities, and many will travel 30 minutes or more on the weekends to occupy their time off from work. This becomes an issue when it's late at night driving on the roads for an extended period of time, or when alcohol may be involved. Since the year 2000, Spring Hill has had a population growth of 32.10%. Because of the surge in population over a short amount of time, the roadways were overcrowded, leading to over 600 vehicle crashes and 457 total injuries in 2015. Fortunately, the county has recently finished completion of a newly constructed roadway that leads through the busiest part of the community. Between last year's and this year's statistics, it has decreased the number of accidents and injuries by almost 200. There is no shortage of healthcare availability in the Spring Hill community. There are 2 hospitals, 5 urgent care centers, 14 assisted living facilities, and 16 companies offering in-home care. There is an acute stay behavioral and mental health facility and 3 mental health counseling facilities. There are a host of primary care physicians and specialists and a community clinic that provides care to those without the ability to pay. The urgent care centers accept most insurances and also treat self-pay patients at a discounted rate. The first community objective regarding Healthy People 2020 that we chose was to increase the proportion of persons with medical insurance in the community. The Institute of Medicine released a report in 2002 stating that in the year 2000, 18,000 people between the ages of 25 and 64 died due to lack of health insurance coverage, showing evidence that an overwhelming amount of deaths among the uninsured are preventable if they could obtain proper coverage. Our second objective was to increase the proportion of persons with a usual primary care provider. There have been many proven benefits of patients who receive care from a primary care physician. According to Friedberg, Hussey, and Schneider, patients that report a usual source of care are more likely to receive recommended preventative services. PCP care has also been associated with better patient experience, greater satisfaction of overall health, lower utilization, and lower cost, including lower rates of emergency department use for non-urgent conditions. Our final objective was to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care. A report released in 2010 on 2007 national statistics showed that persons ages 25 to 64 were more likely unable to obtain or delayed in obtaining needed medical care. Because the population of Spring Hill is primarily made up of persons between these ages, this is an important objective for our community.
Spring Hill adequately provides a number of environmental resources to meet the needs of its residents. Spring Hill boasts multiple grocery stores such as Publix's and Winn-Dixie's seemingly on every corner, as well as provides the option of food and necessities at more of a discounted rate at their new Dollar General located on the county line. CVS and Walgreens have multiple locations throughout the community for shopping convenience as well as meeting pharmaceutical needs. There are also 2 Walmarts located within the city limits offering food, clothing, pharmaceuticals, and household need items. Spring Hill has a total of 10 parks offering anything from leisure activities such as picnicking and hiking to water activities such as boating and kayaking. Multiple parks offer youth and adult sports programs to engage the residents of Spring Hill in physical activity. Hernando County Utilities Department provides water to public and residential buildings, which comes directly from the Florida aquifer, which naturally filters the rainwater and requires little more than chlorine after the process. Quality is periodically checked at various locations of distribution. Sewage and wastewater is sent to 5 different treatment facilities throughout West Hernando County to produce reclaimed water suitable for public access and irrigation in individual residences, as well as parks, golf courses, and common areas. Of concern may be the community of Spring Hill does not have its own police force. Rather, the Hernando County Sheriff's Office is responsible for patrolling Spring Hill and its surrounding communities, serving approximately 173,000 residents. Although it does not have its own police force, Hernando County Fire Rescue Services includes 6 stations located within the city limits, with most stations requiring EMS and paramedic licenses. Therefore, EMS services are a part of the Hernando County Fire Stations. Spring Hill is governed by the elected officials of Hernando County. Community officials are easily accessible to the residents of Spring Hill through the Board County Commissioners meetings, which are held the 2nd and 4th Tuesdays of each month at 9 a.m. in the Hernando County Government Center. Although the public is openly invited and encouraged to attend these meetings are sparsely attended. Many of those in attendance are of retirement age, which may be attributed to the early weekday timing of the meetings when working residents may be fulfilling their job duties elsewhere. The board records the meetings and posts them to their website to offer those that can't attend in person an option to view the material presented. Contact information such as phone numbers and emails are also located here. The Hernando County government is committed to providing the community with stability and excellence by managing public business in a responsive and efficient manner, preserving and enhancing public assets, ensuring a safe and healthy community, as well as creating continuous improvements by means of proactive exchange of ideas within the organization with its citizens. These goals are reflected in areas of economic, political, and public concern in the city's budget, which allocates 45.29% to public safety, and an additional 15% to areas such as culture and recreation, economic environment, human services, and transportation. One day and one night in January of 2015, local communities counted 35,964 people who were homeless or living in shelters, and Spring Hill is no exception. The homeless can be spotted in sleeping bags scattered throughout the city, as well as at major intersections, panhandling to make ends meet. Although Spring Hill offers a website for the needy to locate shelters and services, the nearest shelter is nearly 12 miles away in the neighboring city of Spring Hill. This is problematic as the homeless have limited resources, such as the accessibility of the internet, to locate services as well as limited modes of transportation to get to the shelters and services located outside of the city's limits. The leading cause of death in Spring Hill is cancer, which is the second leading cause of death in the state of Florida. Perhaps the increased incidence of cancer can be attributed to the visible number of smokers within the community as well as those affected by the secondhand smoke that comes as a result. 18.8% of Spring Hill's population is still uninsured despite the implementation of the Affordable Care Act. This vulnerable population has an increased risk of mortality, especially in those diseases such as cancer, where the uninsured have a 50% increased mortality rate. Although hospitals' emergency departments will not turn away the uninsured, this is not considered an economically responsible option for seeking out health care. Spring Hill lacks primary care and urgent care clinics directed at serving the under and uninsured individual. Spring Hill has sidewalks along busy roads such as Spring Hill Drive and Mariner, however lacks these necessities on many of their neighborhood streets as well as the streets directly leading to area hospitals. The lack of sidewalks outside the local hospital is a public safety concern of the residents of Spring Hill as well as city officials, which recognized this dilemma in their city council meeting in August of 2016, stating that all residents, even those whose only mode of transportation is by foot, should have safe access to the hospital. Spring Hill does not have its own police department and counts on the county police department to serve its citizens. This may be problematic as the Hernando County Police Department provides law enforcement services to approximately 173,000 residents, including those in Spring Hill, as well as neighboring cities within the county. The large amount of people for which the department is responsible may create an overwhelming demand on law enforcement services and personnel, resulting in a delay of these services. Residents of Spring Hill have voiced a concern that oftentimes they do not know of available resources because the information is not readily available or accessible. Even community leaders express the need for a community information outreach in some form or another, such as health resources and referral information clearinghouses. The public has identified the need for centralized marketing strategies to inform the public on available healthcare resources. The order of priority of community needs was decided based on Maslow's hierarchy of needs, which prioritizes physiological needs as most important, followed by the safety and security. Access to affordable health care continues to be national concern as well as global concern. Although the implementation of the Affordable Care Act has reduced the number of uninsured persons, there continues to be a number of uninsured throughout the country. In other countries, such as Colombia, the law of the land establishes health as a fundamental right to each of its citizens. Colombia's public health plan is seen as an effective plan as 98% of its citizens have access to healthcare services. In this system, every employee contributes 4% of their monthly wages to the healthcare system, which then provides healthcare services to individuals who sign up for public or private insurance. The community healthcare nurse can intervene by providing education on the resources currently available to the uninsured, as well as the information, education, and assistance needed to help such individuals enroll in the Affordable Care Act, which may provide insurance at a discounted rate or free of charge.